Come in.
Hi, Elizabeth. How are you?
I'm good.
My name is Shannon. I'll be your nurse practitioner student today, and I'll be responsible for your assessment today and taking care of you. Is that okay with you?
Yep.
Is it okay with you that I do a physical examination where I may be required to put my hands on you and touch you?
Yep.
All right. What brings you into the clinic today?
I had an earache.
Okay. Just tell me your name, your full name, and your date of birth for me, please.
Elizabeth Dilger, January 29th, 1999.
Okay. Is it okay if I have a seat and we have some? I ask you about your ear pain?
Nope, go right ahead.
All right. So when did your ear pain start?
About a couple of days ago.
About 2 to 3 days, a week ago?
About 3 or 4.
Okay. So you've had it for about 3 days. Is there anything that seems to make the pain worse or better?
It helps when I lay down on my left side.
Okay. Did you do anything different the last couple of days than you normally would do?
Just probably been swimming a little more.
Have you noticed any nose drainage or ear drainage?
No.
Okay. How about sore throat?
Nope.
Jaw pain?
Just a little bit.
And how about a headache?
I had a little bit of a headache towards the top of my head.
Okay. So your pain is mostly towards the left side of your face and your head?
Yes.
Okay, very good. And the pain, how would you describe your pain? Is it a sharp, an ache, a pressure, or stabbing?
Almost like a pressure pain.
Okay. Now, and the pain, does it radiate into the jaw? Does it feel like it's in your teeth, or just like kind of there, like the whole side of your face?
Kind of just in my jaw a little bit.
Okay. On a scale from 0 to 10, 10 being the worst pain you've ever felt, what number would you rate your pain?
Just a 2.
Okay, so laying down makes the pain better. Have you tried any Tylenol or Advil or a warm compress or anything?
No, not really.
Okay. Have you had any recent dental work or dental issues?
No.
Okay. All right. So it's radiating to the jaw. Is it always there? Is it constantly there?
Yeah, kind of constant.
Okay. All right. So I'm gonna ask you some more questions. So your past medical history. Do you have any illnesses or diseases that you're currently being treated for?
No.
Okay. All right. How about your surgical history? Have you ever had any surgeries?
Yes.
Okay. When was your what kind of surgeries did you have?
I've had a breast augmentation and wisdom teeth removal.
With your breast augmentation, how long ago was that?
About 2 years ago.
And did they reduce your breast or did you have implants?
It was a reduction.
Okay. And how about your wisdom teeth extraction? How long ago was that?
3 years.
Any problems or complications with it?
No.
All right. Are you currently on any medications?
Yeah, I'm on Nexplanon at the moment.
Are you taking any supplements, vitamins, anything over the counter?
No.
To help with anything? Okay. All right. And are you allergic to any medications?
No.
Any allergic to any foods? Do you have hay fever, or allergies, anything like that?
Not that I'm aware of.
All right. Do you currently work?
Yes.
All right. And what do you do for work?
I work at McDonald's.
Okay. Do you work in where you might have to wear a headset?
Yeah, I do.
Do you wear it on that left side?
No, it's actually on the opposite side.
Okay. And have you had, did you notice any hearing loss or anything when you're doing your work or anything like that?
Not
Or
necessarily.
any ringing of the ears?
No.
How about lightheadedness or dizziness?
Just a little bit, nothing concerning.
Okay. Are you still in school?
Yes.
Okay, so you're still in school as well. All right. And do you exercise?
Yep.
How many times a day do you exercise? How many times a week do you exercise?
About 3 times a week.
Okay. And are you sexually active?
I am.
And you're using Nexplanon. Are you using a backup method for STD prevention?
Yes.
And what would that be?
Condoms.
Okay. And what kind of partners do you have?
Male.
All right. And your family, actually, do you smoke?
No.
Do you drink?
No.
Do you do any illicit drugs?
No, I do not.
Okay. All right. Do you try any other substances that you're not prescribed or anything of that nature?
No.
Okay. When you drive, do you wear your seatbelt?
Yes.
Okay, very good. And the last year, have you had your physical examination?
Yes.
And are your shots up to date?
Yes.
Mainly your HPV vaccine, which prevents you from getting the human papillomavirus from having sexual contact with a male, or sexual contact. And the other one we recommend is the meningitis vaccine if you're a student in college.
Yep, I have both.
You have both of those. We also do recommend that being that you're in the environment that you're in, that you do receive your flu shot annually if you can.
Okay.
All right. And your family medical history. Anybody in your family have chronic illnesses or diseases?
No, so they have like asthma, diabetes, heart disease, and just obesity is pretty common. That's about it.
Okay. All right. And who might they be? And do you know, does your mother have some of those things? And your father?
My mother, obesity, and my aunt has asthma. My grandfather has heart disease. That's pretty much about it.
Okay. All right. Do you have any other questions for me, Elizabeth?
No, not at the moment.
So I'm going to ask you some questions about the rest of your body systems. Do you have double vision, or do you have any watery, itchy eyes?
No.
Nasal discharge, runny nose, itchiness in your nose?
No.
Any excessive phlegm or production or anything, coughing all the time? How about any swelling in your neck?
Nope.
Okay. Let's see. Do you have any rashes or eczema or changes in your skin?
No.
All right. Any itchy spots on your skin?
No.
All right. Any chest pain, shortness of breath, if you're doing any activity, or you get really lightheaded while you're doing any activity?
Not at the moment.
All right. Any belly pain, nausea, vomiting, diarrhea?
No.
Constipation. Your bowels? Do you move your bowels fairly regularly?
Yep.
Okay. Any problems with urination, which would be frequency or urgency?
Nope.
That would indicate that you have a urinary tract infection. Any pain in your joints or your knees?
Nope.
All right. Any fevers, chills?
Nope.
Fatigue? Any unintentional weight loss?
No.
Okay. Then today your vital signs were good. Your blood pressure was normal. You didn't have a fever. When the nurse checked your eyes, your eye exam was 20/20. Do you wear glasses at all?
No.
Okay. And your body weight, your body mass index, was we look at every patient that comes in. You are considered in the obesity category. So you do exercise 3 times a week. We can offer you some nutrition guidance, or we can refer you to a nutritionist if you're finding yourself having a hard time losing the weight.
Okay.
Otherwise, you feel pretty healthy. Do you feel like you feel pretty healthy?
Outside of my ear, yeah, pretty healthy.
Okay. And do you know? I'm just going to ask you a couple questions. Do you know what month it is?
Yeah, it's August.
Okay. Do you know what date it is?
Yeah, it's August 4th, 2019.
Okay. And who is our president?
Donald Trump.
Okay. And I need you to tell me what these three things have in common. An apple, an orange, and a pear.
They're fruits.
About a table, chair, and a desk.
Furniture.
Okay. Can you repeat backwards 5, 4, 6, 6 for me?
5, 4, 6, 6.
Repeat it backwards.
4, 5, 6, 6. Oh. 6, 6, 4, 5. Yep.
Yes. Yes.
My memory is not the best.
You're correct. And then I just need you to explain to me what the following, or actually just say the following statement for me. No ifs, ands, or buts.
No ifs, ands, or buts.
Okay, very good. So I think we're ready to move on to the physical examination. Is it okay if I do your physical examination?
Yep, go right ahead.
All right. So I have some supplies here that you've probably seen lined up, and some of the things that we're going to use to check on your ears and your eyes and your nose and things like that, okay?
Alrighty, sounds good.
So I'm going to bring some stuff over so we have it available. I'm going to set it right next to you if that's okay.
Nope, that's perfectly fine.
First thing we're going to start out is I need you to look straight at me. Okay. And what I'm going to do is palpate your head. Do you have any problem with hair loss?
No.
Thinning of your hair? Any itchiness?
No.
Okay. And is your headache on this side here?
It's, more towards the top, yeah.
Okay. Any pain when I push here?
No.
Or here? Those are your sinuses.
No.
Okay, I want to take a look at your eyes. Okay, and I need you to open your mouth for me. I'm just checking your jaw joint here. Move your jaw from left to right. Okay, push it forward. All right, good. Smile big for me. Frown. Wrinkle your forehead. And close your eyes as tight as you can and don't let me open them. All right, stick out your tongue. Wiggle it from left to right. Okay, put your close your mouth and puff out your cheeks. Don't let me push them in. Very good. All right, the next thing I'm going to do is I'm going to do a sensory test on you. I'm going to use a cotton swab. It's called the cotton wisp test. And then I'm going to touch it on your face, and I need to tell you to tell me if you feel it or not, okay?
Okay.
Close your eyes.
I feel it. 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 I feel
Okay,
it.
now this other one's going to be not so pretty. It's not as nice. It's a little sharper. Okay, you're going to feel like more of a pinprick. Okay, close your eyes.
I feel it. I feel it. I feel it. I feel it. I feel it.
Very good. Very good. All right, the next thing I'm going to do is I'm going to check your pupils to see if they're reacting to light.
Okay.
Okay, I'm going to shine a bright light into your eyes. I need you to look straight at me, okay? Actually, let me dim the light. Forgot to dim the light. Okay, we're going to start again. Okay. Very good. I need you to look at my pen. Do not move your face. Follow with your eyes only, okay? Follow it. Back to the center. Okay, look straight at me. Would you tell me when you see my fingers wiggling?
I see them. I see them. I see them.
Very good. All right, next thing I do, we're going to check your hearing, okay?
Alrighty.
I'm going to do a whisper test, and I need you to tell me what two-syllable word you hear.
Okay, sounds good.
What I'm going to do is place my hand on one side of your ear, and I'm going to say something on the opposite side, okay?
Alright, sounds good. 88. 77.
Very good. All right. Now what I'm going to do is I'm going to switch my, actually I'm going to finish checking your eyes because I'm going to finish checking your eyes because I forgot to look at the fundus of your eyes.
No problem.
All right. So I got this light. I'm going to shine it into your eyes and need you to focus on a point straight ahead of you, okay?
No problem.
I'm going to be coming very close to your face and I'm going to be touching your face.
That's fine.
All right. Look straight ahead for me. No hemorrhages. The optic disc is visualized. Okay, you okay?
Mm-hmm.
Straight ahead. Very good. All right, next thing I'm going to do is I'm take a look at your ears. And I will start with the ear that's not sore first, okay?
Okay.
I'm going to take this speculum and put it in your ear and take a look at your ear canal. I see you have your ears pierced on this side. Any pain when I pull on your ear?
Nope.
Okay. Very good. Any pain when I pull on your ear?
Nope.
Okay, I'm going to pull back a little bit. Take a look at the inside of your ear. Very good. It looks like you have a little bit of earwax in there. Okay, why don't you take one finger over your nose and sniff, and on the other side for me. All right, now I'm going to take a look at your nose. What I'm doing is looking at your turbinates to see if they look inflamed or your septum looks fine. All right. Next test, open your mouth for me, please. And say, ah. right, I'm going to put a pair of gloves on because I want to take a look at your inside of your mouth, and I'll turn the light back on.
Okay.
Okay, can you open your mouth for me? Can you put your tongue up to the roof of your mouth? All right, and I'm going to just tap on your teeth, and I want you to tell me if you feel pain, okay?
No problem.
Open your mouth for me.
Nope.
All right, very good. The next test, we're going to move to your neck.
All right.
I'm going to be palpating your lymph nodes. Any pain?
No.
This is your submandibular. This is your preauricle, salivary, cervical, and clavicular. Okay, I'm going to feel your carotid pulse. Keep your head up for me. Thyroid. Head all the way back. Forward. Can you bring your head from side to side? All right, I want you to push up your shoulders against me. Push your face against my hand and against that hand. Very good. Very good. Now the next thing I'm going to do is I'm going to move to the lungs to listen to your lungs.
No problem.
When I place my stethoscope on your skin, I need you to take a deep breath from me, okay?
No problem.
Actually, you having any pain when I press on your chest here?
Nope.
No pain in the chest area?
Nope.
Deep breath. When I move down, I'll need you to hold your breast tissue up for me if that's okay.
No problem.
Can you hold both your breasts up for me as high as you can?
Yep.
Very good. I'm going to listen to the back. Same thing. When I put my stethoscope on you, I want you to take a deep breath.
Okay.
I'm going to move your bra up a little bit. Okay, and what I'm going to do next is I'm going to ask you to say 99.
99. 99. 99. 99. 99.
Okay. And I'm going to tap on your back, okay, with my fingers. Okay, I'm going to be doing that on the front. Can you lift your breasts up for me? Okay, very good. All right, the next thing we're going to do is I'm going to listen to your heart. Okay, your heart sounds. We're going to do one test sitting, and I'm going to have you lean forward for the second part, okay?
Okay, sounds good.
When I place my stethoscope, you just breathe normal, okay? I'm listening for your heart.
No problem.
This is your aortic valve. Your pulmonic. Herb's point. And can you lift your breasts for me?
Mm-hmm.
Mitral. Tricuspid. And apical. Lean forward for me, please. Again. And can you lift your breasts? Okay, that's it for the cardiovascular and thoracic. Now I'm going to ask you to put your gown back on and lay back for me.
No problem.
Can you slide back as far as you can, please? Okay. All right, next exam I'm going to do is I'm going to have you check your belly. Are you comfortable?
Yep.
Just cover you up a little bit, okay?
Thank you.
First thing I'm going to do is I'm going to listen to your belly and then I'm going to touch it and palpate it, okay?
No problem.
Okay, I'm going to listen for your aorta, renal arteries. I'm going to listen to your femoral and touch your femoral while we're here at your hip area, okay?
Alrighty.
Okay. Now I'm going to push on your belly. You tell me if you feel any tenderness.
No.
Okay. I'm going to push in real deep. You tell me if you have any pain. This is McBurney's point. Any pain?
Nope.
Okay. I'm going to be checking your kidneys. It's going to feel a little uncomfortable. Can you take a deep breath? I'm going to see if I can feel your liver and let it out. Okay, can you do on the other side for your spleen and let it out? All right, next thing I'm going to do is I'm going to percuss your belly. Okay, I'm going to see if I can percuss the liver border. Okay, very good. All right, before you sit up, I'm going to have you flex your knees for me. Can you bring your knees up for me?
Yes, ma'am.
Okay, bring your knees up. Okay, what I'm going to be feeling your pelvic bone here. Can you rotate this leg out towards me and then and over your other side there as far as you can? And can you do it on the opposite side? Okay. Go ahead, bring your legs back out. I need you to take this foot and run your heel down that shin. And can you do it on the other side?
Yep.
Very good. Okay, I'm just going to feel for your pulses back here. Okay, and now we're going to sit up and do the next part of our exam, which is the musculoskeletal exam.
No problem.
All right, I'm going to move these out of the way here so we don't knock them over. I did forget to ask you if you could recognize the smell that I have in my hand. I need you to close your eyes.
No problem.
This is testing your cranial nerve bone. Can you identify that smell?
I smell peppermint.
Very good. All right. First thing, I want you to hold your hands out for me. Any pain in your joints at all?
No.
Radial ulnar joint. Okay. Can you go like this? Turn them in and out. Very good. All right. Now, this is your olecranon, radial Very good. Any pain at all?
No.
All right. I'm gonna drop take your gown off for the next couple of tests.
No problem.
All right. We're gonna look at your clavicles. Any pain across there at all?
No.
All right. And then we're gonna look at the joint here and the humeral head. Any pain?
No.
Pain back here with your scapula at all?
No.
Pain there at all?
No.
Your scapula looks good. All right. I want you to put your arms straight out for me. Turn them over. Go like this. And I want you to push against me. Pull against me. Put your hands back out like this. Open. Squeeze my hands real hard. Turn your hands like this. Try not to let me close your fingers. Turn your thumbs up. Don't let me push your thumbs down. Okay. Now, I'm going to hold your shoulder and I want you to resist me, okay? I want you to pull back as I push. Okay, you ready?
No problem.
1, 2, 3. Very good. Did that hurt at all?
Nope.
Okay. Shrug. Very good. Now, arms out. And you reach behind you and put them up your shoulder blades.
Yep.
Any pain with that?
Nope.
All right, very good. Now, I want you to just relax. This is your patella, your patellar ligament, and then the tibia fibula. Any pain in your feet at all? Ankles?
Nope.
All right. Can you push up against my hand? This hand? Push up against this hand. And this one? Push up, up, push down. Push up, push down. Very good. Now I'm going to do your reflexes.
No problem.
Actually, we'll do sensation first and then we'll do reflexes.
No problem.
I'm going to put this tuning fork on your joint. You're going to feel a vibration. I want you to tell me if you feel it or not. Okay? Can you put your hand out for me?
I feel it. I feel it. I feel it. I feel it.
Very good. Close your eyes for me. I'm going to do a dull and light sense. Dull. I'm going to do a dull. Yeah, dull and sharp.
No problem.
I want you to close your eyes. I want you to tell me what you feel, okay?
No problem. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull.
Okay. Keep your eyes closed. I want you to tell me if you feel the left or right or both.
No
Okay?
problem. Left. Right. Both. Both. Right. Left. Both.
Very good. All right, last thing we're going to do is your reflexes. I'm going to start with the brachial reflex here. Relax your arm for me as best as you can. Relax your arm. There it goes. All right. Relax. There it goes. Your patellar reflexes. Your Achilles reflex. Okay. Very good. All right. I'm going to ask you to step off the table. We'll put the gown back on here.
No problem.
Cover you up.
Thank you.
All right. I want you to face that way for me.
Yeah.
I want you to bend over for me. Just checking your spine alignment. Any pain when you bend over at all?
No.
All right, stand straight up. Bend back for me. Left to right. All right, very good. Now, what I want you to do is I want you to walk to the door with your heel to your toes. Come on back. Tippy toes. Very good. Stand with your arms out for me, in front of you. Close your eyes. Okay, open your eyes. I want you to hold your arms out like this. Close your eyes and touch your nose as fast as you can.
Okay.
Very good. Now tip your finger, pointer finger with this finger, tip it together as fast as you can. Other side. Okay, I think we're done. Go ahead and have a seat. Let me cover you back up. It's a little chilly in here.
Thank you.
So Elizabeth, it looks like you have an ear infection, probably caused more likely from the water that was in your ear. What we're going to do is we're going to give you some medication, and you may need to take some Tylenol or Advil if you have pain. Helps with the pain. Okay. And just make sure that you, if the pain gets any worse, that you follow up and make sure you see somebody if it does not go away.
No problem.
All right. Do you have any questions for me?
No, that should about do it.
All right, I think we may order some tests for you. I'm gonna look through your chart and we may have some tests ordered for you. Okay.
No problem.
All right, Elizabeth, you have a great day and thank you for the examination today.
Alrighty, thank you very much.
All right. Bye bye.